May God make all these diseases disappear from humanity. 1. Noma, Cancrum oris. In neighborhoods where a meal is nothing more than a thin bowl of porridge, Noma, Cancrum oris, begins quietly as a sore on the gums, a stinging red dot at the corner of the mouth, then suddenly erupts into a storm of gangrene that eats an entire cheek. A child with measles, diarrhea, or fresh off a hungry season is perfect fuel. Immunity wrecked, the mouth's lining torn, anaerobic bacteria slipping into dirty gum crevices to eat away the flesh. True to the Greek root of noma, meaning to gnaw, a thick, putrid stench, what old physicians called the smell of death, arrives before the face changes. The cheek balloons, the skin blackens as if licked by coal fire, and then a slab drops away, exposing the oral cavity like a black hole. The cruelty is that the pain is sometimes less than you'd expect, nerves already eroded, making the disease all the more silent and terrifying. Before antibiotics, 8 or 9 out of 10 victims died quickly of infection and wasting. Survivors were left with shattered faces, unable to close the mouth, speak, or chew, saliva leaking constantly, scar contractures yanking lips, nose, and eyelids so that every movement hurt. Few realize Europe endured Noma through the 18th and 19th centuries, orphans' wards and famine districts, until hygiene, nutrition, and antibiotics pushed it back into the poverty Noma belt of harsher climates. In that sense, Noma is a moral indictment as much as a diagnosis. It lays bare how poverty, war, and medical neglect can turn the human mouth, the gateway of speech and smiles, into a hollow wound no longer recognizably human. And though today early antibiotics plus nutritional support can save lives, its shadow lingers. One missed meal, a measles outbreak, a neglected rotten tooth, and the gnawing machine can wake again. 2. Radium jaw. In the luminous dial workshops of the 1910s, 1920s, the Radium girls were taught the lip dip paint trick. Purse your lips to point the brush, touch the paint, back to the lips, hundreds of times a shift. The paint, Radium 226 blended with zinc sulfide, sparkled like stars and went straight into their bodies. Radium masqueraded as calcium, lodging in the jawbones and skull, slowly killing the marrow, loosening teeth, filling the gums with pus, and leaving tooth extraction wounds that never healed. One tooth would drop out and drag a sequestrum, a chunk of dead bone, like chalk dust behind it. The mouth reeked of metal and rot, the lower jaw honeycombed until the slightest touch could trigger a spontaneous fracture. Some looked in the mirror and saw ashen white gums. At night, their dresses and hair glowed faintly where paint dust clung, a bewitching shimmer that hid a slow, invisible decay. Foremen swore it was as safe as table salt. Some women even painted fingernails, teeth, and eye accents with the glowing lacquer for fun. A schoolgirl prank traded for a spent lifetime. Once the bone was radioactive, chronic osteomyelitis burrowed fistulous tunnels from the mouth to the skin. Dental extractions only poured fuel on the fire because the tissue had been cooked from within. Treatment meant cutting away segments of the jaw, opening a black, fetid cavity in the center of the face. Infection, anemia, fractures, and sometimes osteogenic sarcoma followed like verdicts read one after another. The horror wasn't only the look of it, but the physics. Radium's 1/600-year half-life. Decades later, Geiger counters still ticked over victims' bones in autopsy rooms, a cold reminder that death hadn't fully switched off. From those hollowing jaws beneath headscarves, the women took their employers to court, forcing admissions of guilt and paving the way for modern workplace safety law. But long before history made amends, Radium jaw had already swallowed their laughter, meals, and dignity, a disease that turned a tiny wristwatch into a countdown clock for their own bones. 3. Mucocutaneous leishmaniasis. In the thick, smoky dusk of the rainforest, sandflies smaller than a speck of dust land on the skin and vanish without a trace, carrying Leishmania brasiliensis, a flagellated parasite that loves to hide inside the macrophages of our own immune system. It starts as nothing more than a mosquito-like bite, then, weeks later, becomes a raised rim ulcer on the cheek or around the nose. The kind of mark jungle hands call a simple forest sore and ignore. Then one day, after the skin lesion has scarred over, the nose clogs for weeks, tiny nosebleeds appear, the voice turns nasal, the face begins to melt in slow motion. The nasal septum is eaten away. The soft palate collapses. The upper lip puckers. Each breath a hiss carrying the sour stink of decaying mucosa. It migrates from skin to mucosa through lymph and immune cells, quietly seeding destructive inflammation and then overdriving immunity, turning the face into a battlefield. Across the Amazon and the forests of Central and South America, this form is called espundia, a name that whispers of identity eroded. The nose loses its shape, The mouth contorts. A smile becomes the fear of being shunned. Few people know that chicle tappers in Yucatan also suffer chiclero ulcers on the rim of the ear, an occupational badge only the deep woods crowd recognizes. Treatment with pentavalent antimonials or amphotericin B can save tissue but carries heavy toxicity. Nausea, cardiac disturbances, kidney injury. Oral miltefosine works too, but demands strict contraception. Even when the infection clears, contracting scars and lost tissue leave a face that may need multiple rounds of reconstructive surgery just to eat and speak again. The melting face disease is terrifying not only for what it does to appearance, but for how it hijacks the immune system itself, waiting until you think you're safe before coming back to eat away at your identity. A chilling reminder that a single bite no one remembers can be enough to erase a human face. 4. Buruli ulcer. Amid the still ponds of the tropics, Buruli ulcer often opens with nothing more than a painless, hard nodule. The skin looks slightly shiny, the touch numb and tingly, like your lip after dental anesthetic. That's when Mycobacterium ulcerans has already been quietly pumping out mycolactone, a toxin that switches off the immune alarm while numbing the area, so the body never calls for help as flesh is being eaten away. Weeks pass and the center of the patch drops out. The ulcer's edges curl up like a collapsing eave. Beneath them, fat has been rendered into a slurry and muscle softens like sponge. There's no overpowering smell, no roaring fever. Just a hole that widens by millimeters each day, as if an unseen spoon were scooping it out. Adults keep working the fields. Kids keep swimming in ponds, until tendons contract, fingers fuse, and elbows lock. And only then does anyone notice the neat little circle has become a crater, boring into limb or face. In West Africa, Côte d'Ivoire, Ghana, Benin, it clings to slow waters and swamps. In Australia, clusters flare in cool, damp suburbs where possum droppings and mosquitoes are common. Clues to reservoirs and vectors that scientists still argue over. Few realize Buruli can reach bone, causing osteomyelitis and permanent deformity. In some villages, an entire generation bears tight, pulling scars that twist mouths, eyelids, and hands, all because it didn't hurt, so no one went in. By the time people wake up to it, they face debridement incisions, skin grafts, and months of rehab. Caught early, a multi-week antibiotic regimen can still halt the invisible spoon. But late cases lose another sliver of flesh every day. The most frightening thing about Buruli isn't spurting blood or pus. It's the chilling silence. How the absence of pain becomes a trap that quietly erases skin margins and devours tendons, until a forgotten insect bite has grown into a canyon carved into the body. 5. Hansen. Down a smoke-stained medieval alley, the leper's bell rings in our collective imagination. Yet much of that is myth layered onto the fear called Hansen's disease, leprosy. The quieter, more unsettling truth is this. Mycobacterium leprae loves the cool parts of the body, ear rims, nasal bridge, fingers, toes, and multiplies so slowly it can incubate for 220 years. It attacks the peripheral nerves, cutting off pain, heat, and touch, and it's that loss of sensation that becomes the trap. A patient doesn't feel the burn from a coal, the dirty nick from a blade, or a shoe rubbing a heel raw. Day by day, chronic foul-smelling ulcers burrow deeper, bones resorb, joints claw into claw hand, feet develop plantar ulcers, eyelids won't close and corneas ulcerate, nasal cartilage collapses into a saddle nose, eyebrows thin. The face swells into the so-called leonine facies, a look that society shudders at and then casts out. The most frightening part is the smell of neglect, untreated sores, exposed bone, the buzz of flies. Consequences of stigma, not of a body magically falling apart. Few people know that about 95% of us are naturally immune, and leprosy is hard to catch, usually requiring prolonged, close, untreated exposure. The bacterium can't even be cultured in a test tube, so researchers turned to the mouse footpad and armadillos to study it. Well into the 20th century, many communities still confined patients to remote lazarets, even though since the 1980s a multi-drug therapy, rifampicin, dapsone, clofazimine, can cure the disease, and early treatment can prevent disability. So what's truly ghastly about leprosy? Not some demonic rot, but a disease that turns lack of pain into a prison, quietly stealing sensation so every scratch becomes an ulcer, while fear and misunderstanding bolt the door just as the cure is being carried in. 6. Elephantiasis. In the humid villages of the tropics, filarial elephantiasis doesn't strike like a storm. It comes on thick, slow, and stubborn. After years of bites from Culex, Anopheles, Aedes mosquitoes, injecting larvae of Wuchereria bancrofti or Brugia, the lymphatic vessels begin to clog in silence. Soft feet blister and balloon. The skin stretches tight and then cracks. And with each acute flare of ADL, acute dermatolymphangioadenitis, with fever, tender nodes, and fire-red streaks, the limb hardens into a heavy fibrotic mass. The horror is written on the surface. Skin thickens and turns bark rough. Pores gape like tiny insect eyes. Fungi and bacteria colonize the folds, and a salty, sour odor lingers. Every small scratch can spark a new inflammatory attack, and each round of scarring seals the lymphatics tighter. In men, hydroceles can swell to dozens of kilos, a boulder to be carried day and night. Ruptured lymphatics can even turn urine milky white, siluria, a humiliation few can name out loud. Few people know the microfilaria keep time, peaking in the bloodstream at night, exactly when mosquitoes feed, a dark kind of circadian rhythm. Or that the worms depend on the endosymbiont Wolbachia, which is why doxycycline can starve them of their lifeline. The disease doesn't spread by handshakes or hugs, and it isn't present at birth. It's the accumulated aftermath of bites, secondary infections, poverty, and uncared-for skin. When it's advanced, treatment is a long road. Meticulous hygiene, keep skin dry, treat fungal infections, elevate the limb, compression bandaging, lymphatic exercises, and sometimes scrotal surgery. To break transmission, entire communities take mass drug administration, ivermectin or DEC plus albendazole, for years. Elephantiasis is terrifying, not just because living flesh turns into a stone-heavy weight dragging across the ground, but because it steals shape and livelihood, turning every step into a reminder that a single mosquito bite can rewrite a life. 7. Fibrodysplasia, Ossificans progressiva. In a child born with a malformed great toe, short, twisted, almost as if wrenched sideways, an eerie script is already written. FYP, Fibrodysplasia ossificans progressiva, a disease that turns muscles, tendons, and ligaments into bone, building a second skeleton around a living person. It starts with hot, painful swellings like deep bruises along the neck, shoulders, or back. A few weeks later, those spots harden and actual bone forms, bridges that fuse joint to joint, locking the shoulders to the rib cage, the spine to the pelvis, the skull to the jaw. Few realize the culprit is a mutation in ACVR1 ALK2 that jams the bone formation switch on. That's why any small trauma, a bike fall, intramuscular shot, biopsy, even a tooth extraction or an overzealous stretch, can ignite a flare and leave behind a new sheet of bone that never goes away. The horror of FOP isn't gore. It's the feeling of being fossilized while awake. Yesterday you could bend to tie your shoes. Today your neck won't turn. Next week you can't lift your arm. Bit by bit the jaw stiffens so the mouth won't open. The ribcage locks, breathing turns shallow, and pneumonias creep in. Many learn to sleep sitting up, haunted by the thought that one careless bump might cast yet another layer of bone. The tragedy deepens with misdiagnosis. An FOP lump is often mistaken for a malignancy, and the very biopsy meant to find the truth can trigger runaway bone, sealing joints for good. There's no safe scraping it out. Surgery usually makes it worse. A brief steroid window can help right at flare onset. Experimental pathway inhibitors, RARG or AKT-mTOR blockers, anti-activin A approaches, have only slowed things in a few cases. FOP is thus biology's quiet nightmare, life's growth signal twisted, forging a prison of bone that swallows posture, voice, and the simple right to touch the world, until the body becomes a statue that feels its own fear. 8. Epidermodysplasia verruciformis. Under the brutal tropical sun, epidermodysplasia verruciformis, EV, often begins quietly. A few flat warts and pale pityriasis-like patches on a child's forearms. Year by year, those patches hyperkeratinize, stacking keratin into root-like wooden outgrowths that cling to the hands, ankles, and face. Nails curve into claws. The moist web spaces between the fingers macerate and superinfect with fungi and bacteria, leaving a musty, sour odor. The horror isn't gore so much as the sensation that the body is sprouting wood. Movement narrows, gripping becomes torture as the bark splits and weeps. What most people don't realize is that the HPV here isn't the sexually transmitted kind tied to cervical cancer. EV is driven by beta HPV, classically types 5, 8, and kin, that are harmless to most of us. But in EV, the body loses its immune brakes, and the virus takes command of keratinocytes. The reason lies in autosomal recessive mutations. most often TMC6, TMC8, Ever1 Par 2, sometimes CIB1, that derail zinc regulation inside skin cells. HPV needs zinc to replicate. When the cellular zinc vault sits wide open, the virus turns the epidermis into a factory for warts and plaques. Under relentless UV light, many cases slide into the nightmare act. Those plaques degenerate into squamous cell carcinoma on the face, ears, and backs of the hands, often in the 30s or 40s. And the bark stops being a deformity and becomes a death sentence waiting. And the cruel twist, there is no definitive cure. You can cut, shave, or cauterize the growths and they grow back. Topicals like imiquimod or 5-FU, systemic retinoids, acitretin, interferon, even combination regimens, at best they slow the tide. Sunlight remains a fertilizer for the lesions, so rigorous sun protection becomes a daily rite of survival. EV is, in that sense, HPV's forgotten nightmare. A tiny genetic glitch lets a no-name skin virus play malignant carpenter, nailing extra planks onto a living body, grotesque and merciless, whittling away function, dignity, and the chance to avoid cancer, unless the condition is recognized, protected against, and monitored in time.